So we have Kendal Martes here, who is going to be talking about from evaluation to impact, supporting students with developmental language. Kendall, thank you so much for joining us today.
Of course, it's my pleasure, Vanita. I'm happy to be here.
So by the end of this podcourse, we hope that you'll be able to define developmental language disorder and explain its core diagnostic characteristics, identify three key components of a comprehensive evaluation for DLD, describe two ways DLD intersects with dyslexia in school age students, and describe evidence based strategies, at least two, that SLPs can use to improve academic and language outcomes for students with DLD. Here is our agenda. We're going to start with our introductions and backgrounds and then get into understanding developmental language disorder. Then we'll talk about evaluating for DLD. Then we'll talk about the intersection between DLD and dyslexia, and then how to improve outcomes for students with DLD. And we'll wrap up with references and closing remarks. Kendall, can you come on and tell us a little bit about yourself?
Of course. So, I am a certified speech language pathologist. I've also gone through advanced training in structured literacy methods, including Morton Gillingham instruction. And so, I also carry certification as a structured literacy dyslexia interventionist. Currently, I worked as a director of outreach at a independent school in Massachusetts, and our independent school is unique where it has an integrated program for students with dyslexia within the school. I also teach in the special education department at Rhode Island College, and currently I'm pursuing a doctorate in special education at the University of Florida, and I'm specializing there in dyslexia and literacy. I have worked as an SLP for close to 20 years now. I've worked in healthcare settings, public schools, independent schools, and also private practice. My passion really lies in the early identification of learning disabilities and how important oral language is to literacy development.
Thank you so much for sharing that. I don't know if you saw the post that we recently did. They were looking at how oral language impacts literacy development amongst individuals who use AAC. And it was really, really interesting. So hearing how, like, you're talking about the impact of oral language on literacy is also really interesting. Just briefly, they had discovered that children who had better oral language skills had better literacy outcomes, but there was no correlation for the children that, or no improvement, I guess, for the children that use AAC as a mode of communication. But then we also said, like, let's not jump to conclusions here. Like, children with AAC may have not received the same type of instruction, or the person doing the assessment may have not utilized the AAC mode as proficiently. So it was just interesting. And hearing you say that made it even came up again.
Yeah, there's a lot of work too in kind of the not so much dyslexia field, but structured literacy more broadly about teaching students structured literacy, delivering that type of instruction to students with complex communication needs. So that is a burgeoning area, I think that research and practitioners are looking to learn more about.
Yeah. Do you have people in your cohort or other students in your cohort who are focusing particularly on that population, or is it
I
more?
have one person in my cohort who works with students with visual impairments. So I don't think she's focused necessarily on the connection to literacy, but I know when I go to conferences around the country, I've seen a lot around AAC users and literacy and using AAC to teach structured literacy and making sure that AAC users still have access, like you said, to that quality instruction so that they can benefit from it as well.
Yeah. Oh, thank you for sharing that. It's definitely a passion area of mine for sure. But my name is Benita Lisak. If you are here for Kendall and we have not met before or you've never listened to the podcast, I've been an SLP since 2014. I'm the host of this podcast, which is part of the Tassel Learning Network. I am the continuing education content consultant for Tassel. I have a small private practice and I am a doctoral student at Northwestern University, focusing on the science of teaching and learning. I have ownership interest in Speechie Side Up LLC and Tassel Learning LLC. How about you, Kendall?
I earn a salary for my work at Friends Academy, as well as compensation for my part-time role at Rhode Island College. I'm also receiving a stipend for this pod course. I don't have any non-financial conflicts of interest, although I may mention some tools that I like. I don't profit off of that mention.
Thank you for sharing that just in case. So let's talk about developmental language disorder. I'm sure that any school based SLPs listening probably have come across this term, but whether it's well understood or not is questionable. So let's dive into it.
Sure. And I would be curious to know if school SLPs have come across this term because one of the issues with DLD is that has very poor branding. It's been called a lot of different things. So you might have heard of it as specific language impairment. Clinically, if you're using the DSM to diagnose, it could be mixed receptive expressive language disorder. It could just be under a speech and language impairment if you're qualifying a student for an IEP. So there's lots of different terms for this, which adds to the confusion. So really my hope is today that I can clarify some of this. So developmental language disorder, what many refer to as DLD, is very common. It's a neurodevelopmental condition. And what I mean by that is that it's present at birth. It's a difference in the brain circuitry and the brain's ability to process and produce spoken language. So, again, it is highly prevalent. It affects around 7% of children, which equates to roughly 2 children in every classroom of 30 students. So, that's very common. In fact, it's more common than autism and more common than a hearing impairment. Importantly, DLD is not a result of any underlying biomedical condition. And all of this, if you really want to dive in more about kind of how DLD intersects with other communication disorders, there is a link to an article, the Catalyst Consortium, which was this big group that held a panel to kind of define a specific language impairment or DLD. They all met and kind of talked about the characteristics and what we were going to call it. And this is from 2017. And they have a really nice visual in that article. It's a Venn diagram that kind of shows the intersection of DLD with other communication disorders. And one thing that I really want to stress is that DLD is a language problem. It's not a speech sound disorder. So, and this might make sense to SLPs, but sometimes teachers need clarification about this. But SLPs understand that speech and language are two different things, right? So, kids with DLD speak clearly, it's their language output that is disordered. So, and they show that disorder at the word level, the sentence level, and the discourse level. So what that ends up looking like is children leave off the word endings when they're speaking. They might have some word retrieval or using very vague words to describe what they want to say. They struggle to follow multi-step directions. They may need extra time to really process questions, to formulate their thoughts. They likely have difficulty telling a clear story with a beginning and middle and end. And overall, just they'll appear very disorganized when they're explaining their ideas. Because of those oral language impacts, children with DLD will likely also then have difficulty with reading comprehension and written expression. Again, this DLD can present differently across individuals. So I'm not saying that just because one student has DLD that they'll all struggle with reading comprehension, but that's a likely effect. If you're not understanding language when it's produced orally, you're likely going to have difficulty understanding it when it's in text. DLD also impacts a child's ability to effectively participate in conversations with peers, and so therefore it can impact a child's ability to really form social relationships. Despite how prevalent DLD is and these wide range of impacts, unfortunately, children with DLD really do go undiagnosed or misdiagnosed. For instance, I've seen a lot that students with DLD could be labeled as inattentive and maybe have some attentional vulnerabilities. So, difficulties with spoken language can look like that, right? If you're having difficulty processing spoken language in the context of a classroom, I think anybody might tune out and look unfocused. But if we assess their oral language skills, we may find that it's not necessarily a focus issue, it's more of a language issue. So that's just one reason why DLD is underdiagnosed or misdiagnosed. It can really be hard for folks to pinpoint that language is the problem. It's also underdiagnosed because many of these children learn to mask their difficulties until academic demands really increase later in the school age years. So, kindergarten, first grade, second grade, they look like they're okay because it's a lot of routines, it's very concrete language. But then as academic demands increase, as social demands increase, students really start to struggle. And that's where we see again the impacts of DLD.
Thank you so much for breaking that down. Do you happen to know what the comorbidities are like with DLD, like the rate of comorbidities?
Yes, and we'll talk about that a bit when
Okay.
I know that we want to discuss the comorbidity of DLD and dyslexia. But DLD and dyslexia co-occur nearly 50% of the time, and
Mm.
DLD and ADHD co-occur up to research shows about maybe 75% of the time. There is a
Wow.
wide range, and there's still much more to know and learn. But I think the main takeaways is that DLD and ADHD often co-occur. And it's important then for evaluation purposes, it's really important to kind of tease apart those different disorders.
Yeah. Thank you for sharing that. So, when you're treating DLD, are you treating the language areas that they're having difficulty with? Are you treating executive functioning skills? What is
That's
the
a great
main
question.
focus?
You're really targeting those underlying language skills. So when we go to evaluate for DLD, we really have to look at the child's strengths and needs in terms of their oral language. We want to really target the areas that they're struggling the most. So that might be vocabulary and building semantic relationships between words. That might mean working on syntax and developing the ability to produce complex syntax and understand complex syntax. That might look like working on inferencing using spoken language. That might look like narrative language, right? Producing narratives, understanding story grammar. So it really depends on the child. But I would say those kind of four areas that I just mentioned are the most common intervention targets for a student with DLD.
That makes sense. Some of these symptoms look a little bit like auditory processing disorder. So, do you find that that can be an off common misdiagnosis?
Yes, I'm so glad you brought that up. I often get that question about how this relates to auditory processing disorder. And I would be, as a fellow SLP here, I would be curious to know your thoughts. But what I find with auditory processing disorder, it's that it's not an overly helpful diagnosis to families and students. Mostly everything that we are asked to process auditorily is language, right? So I find, to your point, Vanita, I do find that by labeling auditory processing, we're most likely labeling DLD, that child is struggling to process language. It's not just sounds, it's language. And so yes, I do find that that can be another one of those labels that's kind of out there but not really getting at the actual disorder, not really labeling appropriately.
Interesting. Yeah, I haven't worked with children with auditory processing disorder in a long time. Want to say that we targeted language as the approach, but yeah, it'd be interesting to see how people are targeting it nowadays. I know there's a bunch of super duper resources for auditory processing disorders. I'm curious to go back and see how those address it.
Well, and I think again, that's appropriate, right? Because auditory processing, where that's what we process is
Mhm.
language. Oftentimes students receive that auditory processing diagnosis from an audiologist, and the recommendations from that report may include amplification
Mm.
devices or, preferential seating. And while that's all well intentioned and fine, amplifying the sound of language won't necessarily help them if they can't understand language. And so I think it is appropriate then again we have to treat the underlying language system. We have to intervene in those vulnerable areas, not just amplify, not just accommodate, but actually remediate.
That's such a great point. It's almost like receptive language processing disorder, but then really DLD. And then do you find that with DLD, like there can be solely receptive language difficulties or solely expressive language difficulties, or is it usually a combination of both?
Great question. I find that it's a combination in both. Again, going back to kind of when I evaluate, I don't really solely look at receptive versus expressive necessarily. I look at it more, what can the child do at the sound level, the word level, the sentence level, and the discourse level. And I look at both their ability to process and produce in those different levels because I think there's a lot of interconnection between the two, right? You're probably going to produce things that you can understand and vice versa. So I don't find it overly helpful in looking at like the receptive versus expressive. It's more helpful to me if I'm planning intervention for a child at looking at, again, sounds, words, sentence, discourse.
Mhm. That makes sense. How early do you tend to see these symptoms?
They can be as early as preschool age
Mm.
when a lot of times kids that might be labeled late talkers, that most likely will be DLD. I would say probably all kids with DLD were late talkers, not necessarily true the other way. There may be some late talkers that don't go on to develop DLD, but in general, these symptoms occur very early on. So when, typical language development informs us that children go through a language explosion around 2 years of age where they're starting to put words together to form basic phrases, right? That morphological development is really exploding. Kids with DLD will struggle with that. They'll already show evidence that they're struggling with that, with expression of language and putting ideas together. And so it can, again, if it's not, and we'll get into this a little bit more with evaluation, but if we're not really using good tools, being really open to identifying DLD, if we don't have awareness of what it is, then we're likely not going to identify it well. So these symptoms though do exist in young children.
That makes sense. Thank you for sharing that in case anybody's working with early intervention or younger children, they know what to look out for. So, how do you evaluate DLD?
Yeah, so in terms of evaluating for DLD, it's not just a matter of administering one single test and then I really find that we have to collect multiple sources of information to really figure out the child's strengths and vulnerabilities. So, first, it starts with really taking a thorough case history, understanding if there were any early language delays, like we just mentioned, understanding if there's a family history of language or reading difficulties. Again, dyslexia and DLD can run together very often. And so, sometimes, if there's a family history of reading difficulties, there may also be some language difficulties in there somewhere too. So, understanding the family history, or if there's a history of early language delays, what the academic concerns are for the child, even beyond just reading and writing. Kids with DLD tend to struggle across subject areas because we use language to learn. It's present throughout our whole school day. And so kids with DLD, pretty significant DLD, will really struggle across the board. So get a sense of how they're struggling, what the concerns are, and then getting input from the teachers and families about how the child is using their language functionally. So how are they doing with following directions? How are they doing with explaining their knowledge, telling about their day? Getting a sense of that is really important. That helps the SLP understand what the functional impact of those language skills are, which is a critical point to diagnosing DLD. And then, of course, you want to rely on standardized assessments, and I certainly do. Again, I don't look at it so much as the receptive versus expressive construct. I like to look at and perform assessments that look at sound versus word versus sentence versus discourse levels, and really, because then you're really able to tease apart what the child is stronger in and what their weaker skills may be. So one test that I really like to use that does a really good job of kind of looking at it like that is the TILS, which is the test of integrated language and literacy skills. So not only does it have the oral language component, which is what we would think of as DLD, it also looks at the effects on written language as well in the same construct. It looks at how a child can process written language at the sound level, the word level, the sentence level, and then the discourse level. And so it really, and again, going back to the connection with dyslexia, when you use a tool like the TILS, you can really start to see, is this child presenting with DLD? Are they presenting with dyslexia? Are they presenting with both? So it is a test that I often rely on because it really gives me that good information. And to the point about standardized scores, it's important to not just rely on the composite scores. Obviously, composite scores are important for finding, and making broad generalizations about a student's skills. But I really think if we want to evaluate thoroughly for DLD, we have to look at the student's individual performance on the individual subtests and look to see what might be relative strengths and relative weaknesses. And then, again, I would just want to hone in on the point that we consider what the standardized test results are telling us in light of what we know about their functional language skills. We need to make sure that when we're assessing for DLD, we're connecting their language weaknesses that we see on the test scores to how that plays out in the classroom and at home and with friends. And so we looking at it kind of, again, the bigger picture of what's going on for the child.
Thank you for sharing that. And also the test. One of the questions we get often is, which test do you like to use for an assessment? So I think that will be very helpful for people.
Good.
I know we're going to jump into DLD and dyslexia soon, but I'm hoping you can answer this question here. Does DLD make dyslexia treatment take longer?
That is a great question. And that is honestly what got me really interested in kind of the connection between dyslexia and DLD. I still work at a school with an integrated dyslexia program. And I did find that when we looked at the students' profiles a little bit more deeply, the students that were slower responders or needed kind of different intervention techniques were often the students that had dyslexia and DLD profiles. And so it's, again, I don't want to broadly generalize that it will be that way for all students that have DLD and dyslexia, but yes, it can, because again, oral language is the foundation to learning how to read. And so if that foundation is unsteady, it's really hard to kind of make gains. And so when I evaluate students and I do find that they have dyslexia and then also co-occurring DLD, I always recommend to educators that we have to tackle both problems simultaneously. We're not going to prioritize one over another because working on oral language will simultaneously help written language and then they'll reinforce each other. And so I guess the answer is yes, that having oral language concerns does make dyslexia treatment more difficult. I also think that if we work on oral language with all kids with dyslexia, then that will help them along further. Even if a child with dyslexia doesn't have a diagnosis of DLD, they'll still likely have some language difficulties, such as word retrieval or, disorganized language. They're having trouble kind of struggling to formulate their thoughts. So working on oral language is beneficial for all kids, not just obviously it's essential for kids with DLD, but it's really beneficial for all kids.
Yeah, I can see why that would be important to work on it with all the children. So thank you for sharing that. So I just want to make sure that I am covering or that we're covering all of the tests that you would recommend. So you have the case history, possibly the TILs, any other assessments that you would recommend or that you use?
I also, because again, DLD runs closely with dyslexia, I like to examine for both. So
Okay.
I routinely give tests that look at, if there's a dyslexia going on. So the CTOPP, which looks at phonological processing, is one that I often use. I'll look at word recognition using the test of word recognition efficiency. I really like to get a really good spelling sample. The TILS has a non-word spelling, so then I'll do a real word spelling using something like the test of written spelling. And sometimes I might supplement with another written language or another oral reading fluency measure. The GORT is one that I use sometimes for oral reading fluency. That's where kind of the case history is important to me too. When I gather the information about how the child is struggling according to the parents and the teachers, then I try to tailor my assessment tools to really gain information about those areas of potential weakness.
Okay. Thank you for sharing that.
Mhm.
Forgive my ignorance, and also I may have pregnancy brain. Obviously, we can diagnose DLD, but what about dyslexia? I can't
We can
remember
di
if that.
we
Okay.
can diagnose dyslexia too, which I'm so glad you asked that, Vanita, because I I don't know how confident SLPs are in doing that. I think if you understand the constructs of language, you can confidently diagnose dyslexia because uh it's the same components of language just in written form. And again, there's such an overlap. I have been diagnosing dyslexia for quite some time, and I feel that SLPs have a really good understanding of language systems, which again is so important in understanding what dyslexia is. So, yes, the short answer is yes, SLPs can diagnose dyslexia, and I certainly do.
Thank you for confirming that. I thought so. We did a dyslexia conference like 2 years ago, but it was escaping me. So let's talk about how DLD intersects with dyslexia a little more.
Sure. So, from the very beginning, oral language sets the foundation for learning how to read. Children learn how to perceive sounds and words, which then layers onto their ability to match those sounds to letters in the alphabet. And so, from the get-go, oral language is part of learning how to read. And so, I think when we talk about DLD and dyslexia, which are both disorders, which is atypical development, we have to start by first understanding that strong connection that language has with reading. And one very simple way to understand it, and I don't know how much the podcast viewers will know this term, but there's a theoretical model that's been around for quite some time, since 1986, actually, and it's called the simple view of reading. And it is really quite simple in that a skilled reader has to have two components in order to comprehend what they read. They need the ability to read the words on the page, so decoding, and then they need the ability to understand language comprehension. If any of those areas are weakened, or both areas are weak, then they're likely not going to be able to comprehend what they read. And so, again, The Simple View of Reading by Gow and Tumner, 1986, which is the year that I was born, so it's been around for quite some time, really helps us identify that if a student is struggling with word reading, that's typical dyslexia. And if a student is struggling with language comprehension, that's typically DLD. And then a student that struggles in both areas has both dyslexia and DLD. So dyslexia and DLD are separate disorders, but they are frequently co occurring. About half of children with dyslexia will have DLD, and about a half of children with DLD will also have dyslexia. So again, if a child can read the words on the page, but they can't explain what they mean, then that's likely DLD. So we have to really assess language comprehension with struggling readers to understand what the issue is. And so, and we'll talk about this a bit more, but SLPs, again, this speaks to the large role that SLPs can have with reading and reading intervention. Sometimes we're the experts in language comprehension, right? We have a lot to bring to the table in terms of language comprehension. And there are a good amount of kids out there that are struggling with reading because they can't comprehend the language.
Yeah. Well, is that simple view of reading, is it the same as the reading rope?
Good question. It is not, but the reading
Okay.
rope is an expanded view of that. So the reading
Okay.
rope is Scarborough's reading rope. That's also been around for some time. Hollis Scarborough. That's expanded. And so there's the two sides of the rope are word recognition and
Mhm.
language comprehension. And then the reading rope expands those skills further, that's another great kind of model that I have showed parents before to really explain to them, we need both sets of these skills to really become a fluent and proficient reader. And the ultimate goal of reading is to understand what you read. And so it's great to be able to read the words on the page, but if you can't assign meaning to it, if you can't talk about what you read or learn from what you read, then you're really not a proficient reader yet. And so language comprehension is such an important part of reading. And again, that speaks to SLP's role and what we can do to support kids.
Absolutely. Thank you for sharing that. Yeah, I remember seeing that in the reading group with the word reading and language comprehension, but I didn't remember the term simple view of reading. So that makes sense. And it's kind of nice to see it broken down. Like if they're having difficulty in this area, that's most likely dyslexia. If it's this area, then that's most likely DLD. Can we dive into the controversy a little bit around the science of reading versus the other approach? And like as you're talking about this, I can see why the other approach fails in terms of like the language comprehension. Actually, both, right? Like,
Yeah, so it is it's I guess, and some people might refer to it as a war, right? I guess
mhm,
right now there's the science of reading is just referring to not necessarily an approach. It's a body of research that shows us and tells us how the best ways to teach kids how to read. And what we've been talking about, the simple view of reading, Scarborough's reading rope, all of that is validated by the science of reading. So we understand that kids need both sets of skills. So there are, in my opinion, right now, and again, I'm trained in Norton Gillingham. I understand how to teach kids phonics, and it's really important to teach them phonics systematically. But we can't forget about that other set of skills too. And I think if I'm trying to see both sides of the science of reading versus what was also known as balanced literacy in the past. In the past, there were a lot of folks and teachers that used balanced literacy to teach kids how to read. And that doesn't align with the science of reading. It was a lot of teaching kids to guess based on the meaning, based on the picture. While I understand that's not an effective way to teach kids, I kind of see their perspective in that we do need meaning in some way. We don't just read the words on the page by just looking at the letters. Obviously, we have to use letters. That's an important part. But quickly in the reading brain, we assign meaning to those words. And so it's not the first way that we teach kids how to read, but we do have to pull in the comprehension. And so I think so there's been in the past probably 4 to 5 years, there's been a huge push for more phonics programs that teach kids how to systematically decode and encode words, which is great, which is important skills. But now I think we're starting to see, at least I sense, there's a lot of work being done to make sure that these curriculums also bring in the opportunity to develop comprehension. So, vocabulary, for instance, not just teaching the kids that act says cat, but what is the meaning of cat? Another word could be feline. It's connected to dog because they're both pets. Really just developing the language comprehension alongside of the phonics. And so that's where I would like to see the discussion head is how can we get kids decoding, but also understanding too at the same time?
that's a great point. it's like with everything, right? It becomes this pendulum where one side, is better than the other, and then we swing to the other. And why can't we just be in the middle? Why can't it be like an and versus an either or? I don't get it.
I am so with you, Vanita. I think folks feel really strongly about programs that they've been trained in, methodologies that they've been
Mm.
trained in, but we have to remember that it's about the children, and we have to remember that science evolves, that, we're learning more and more with each passing year and with each child that we work with. So I think we have to just be humble and be open minded and be willing to consider other perspectives or other ways of doing things.
Absolutely. Yeah, I saw a balanced literacy program. I can't remember the name, but from that podcast where they kind of stirred up all of this.
Told a
My
story.
Yeah, thank you. But I can't remember what the program was actually called. Do you happen to know on the top of your
Yeah,
head?
there were 2 programs sort of that came under fire in that podcast.
Foundations?
It was
Or
Foundations is a Wilson-based program, which
oh,
is
okay, not
that
that one
teaches
then.
Fontes and Pinnell is one that was,
Yes.
sort of an approach where they taught kids to guess, and then Lucy Calkins, kind of the writer's workshop model,
Writer's
reader's
workshop.
workshop model also came under fire. Just again, not because people felt like antagonizing certain individuals, but because the science had evolved and showed us that isn't the way that children learn how to read and that they do benefit from systematic instruction. I just don't want us, like you said, to swing the pendulum too far in that phonics direction and forget that it's about kids making meaning. Like, they don't have to be little linguists. They don't have to know all this stuff about a closed and open syllable. I just want them to understand what they read. So,
Mhm. That makes sense. Yeah, it was the writer's workshop. So that I saw in my daughter's classroom, and I was like, "Oh." And then I spoke to, thankfully, another mom in the classroom is a reading specialist. She has her master's degree from Columbia, which is where that started.
yeah, yes,
And so she kind of explained to me like how, supplementing that with the decoding is
right.
important. And I was like,
Exactly.
okay.
Good. I'm glad your mama fears were assuaged there. That's good.
Yeah, her son is reading in pre-K, so I was like, "There's something here. Clearly,
She
she's doing
knows what
something
she's
right."
doing. Yeah.
Yeah, exactly. So, what can SLPs do to improve outcomes for students with DLD?
It starts by just being able to identify them. Let's find these kids that are struggling because they're struggling greatly and we really need to help them. So it starts by SLP screening for language. I've worked in public schools. I Articulation is easy to identify, it's easy to treat. We can't forget about the language skills. So let's make sure that we're adequately screening kids. We're talking to teachers who might have information about students who could be struggling. So I think it starts with just improving our methods to identify these kids. We talked about making sure that we're looking at individual subtest scores and not just looking at composites, making sure that we're using our clinical judgment, which we're really trained to do, using our clinical judgment to look beyond the test score and see the kids that are struggling to use and understand language. It also involves collaboration, being able to partner with people like reading specialists and special educators in terms of identification, but also in the delivery of those interventions, right? We were just talking about structured literacy. SLPs have a role to play in structured literacy. We can't we want to get kids reading, right? And it's going to take all hands on deck. We don't want to work in silos. We want to talk to each other and learn from each other. Maybe there's an intervention skill that the students are working on with the special educator or reading specialist. The SLP can work on those things too, but maybe presented orally. So there's ways that we can work on the same goals with kids. And so I would encourage SLPs to talk to their colleagues and find out about what they're working on in reading. And then still providing, going back to what we were trained to do, which is providing really good evidence-based intervention to treat oral language. It may look like treating vocabulary skills, explicitly teaching word relationships, categorizing, forming associations. We want to really build their vocabulary depth. We might work on syntax, right? So producing and understanding complex sentences, using conjunctions, things like that. And then story grammar and teaching narratives, teaching the structure of a narrative and getting kids to produce narratives. And then also inferencing, I see as a big weakness for many students with DLD. So practicing that within the context of speech language therapy. And then lastly, I think, and this kind of goes back to the identification, but we just need to foster awareness of DLD in general. That's why I'm out kind of talking to you today. And I do present on DLD quite a bit because there's just such a lack of information about it. And I hope that with dyslexia is now, I would say, a pretty common term. It's a household word that most people understand. That's what I want for DLD. I want DLD to have that same level of brand awareness that dyslexia has. And so while DLD is not its own category to qualify kids for an IEP, we could use the word DLD in our reports and even the Department of Education published a memo, I think it was in 2023, saying just that again, it may fall under specific learning disability or speech and language impairment, but in the report, the SLP could write that this child is presenting with developmental language disorder. And we should do that because that's going to build that awareness and give a consistent label to this significant issue. I also think that in general, SLPs have a role to play in just educating teachers on the importance of oral language and that oral language DLD may present difficulties for their students in math. They may have trouble with writing. They may struggle to learn content area subjects. And so we really need to educate about how oral language serves as the foundation for learning. And lastly, and this is something that I'm personally very passionate about, is I really want to disrupt wait to fail models. And this is true about dyslexia too. There's a lot of kind of the sentiment of, well, we can just wait and see how it goes. We don't have time to wait with kids. Their self-esteem, their identities, how they feel about themselves as learner are formed very early on in their schooling. And so we want to set them up for success as early as possible. And so just like I have found that we're doing better with reading screenings at earlier ages, now let's screen for oral language, or let's do it in the context of reading screenings, because again, oral language serves as the foundation for literacy, so we should be screening for it. Then we'll catch these kids before they actually fail. We'll flag them and provide them with the intervention they need. So I really think that, school teams could consider, again, how can we catch these kids early so that they benefit from early intervention?
Absolutely. It sounds like with the co-occurrence of ADHD,
Yes.
that partnering with anybody who is big in that area could help bring awareness to DLD. And then also you had mentioned that all kids with DLD were late talkers, but it doesn't mean all late talkers have DLD. So I don't know how you could handle that, but I'm just thinking like there's a lot of parents who are concerned about their child being a late talker and just like putting that awareness out there that DLD could be a possibility.
Yeah, like pediatricians, for instance.
Right.
And again, I think folks in the dyslexia world bring up the same issue is that pediatricians are another group of folks that are on the front lines with kids very early on, talking to pediatricians about what DLD is and isn't. Because if a parent has a concern about their child's speech at a young, when their child's very young, the pediatrician is often one of the first people they're talking to. So I think that's a group of folks that have a vested interest in this, as well as preschool teachers, early childhood teachers. They should be aware of what DLD is. And then, frankly, all teachers. These kids are in their classrooms. They're just maybe not detected yet or labeled in the right way. But once we can label them correctly, we can get them the right help that they deserve. And really, with the right types of supports and the right type of interventions, kids with DLD will really thrive. They can go on to be very successful, very capable adults. They just need people that can explain to them what's going on and how they can help.
That makes sense. Do you have a recommended language reader that you use?
Yeah, so I would say there's a new one that's come out that I've heard a lot about that I haven't used personally, and it is called Language Screen. So it's Charles Hume, Hulme is one of the people involved in that product, and it comes out of the UK. I saw him present at the International Dyslexia Association this year on that topic, and there is some really good research coming out about how it's pretty easy to screen kids using that, and that it's pretty sensitive as well in picking up the kids that need to be found. And so that is one, again, I haven't used it personally, but that is one that I would probably recommend to folks given that it has pretty good evidence thus far.
Okay,
The
great.
another one actually that I did wanna recommend that now that I'm thinking of it, I use the Cubed, which is from Language Dynamics Group. The Cubed is available for free actually on their website. What I like about the Cubed is that it has both decoding and language comprehension measures. Their language comprehension measure looks at children's ability to understand a narrative, and so they read a narrative and then they tell it back to you. Then you ask them some questions, both factual and inferential. And then you also ask them some questions about vocabulary words. So you get a lot of good information just from that one kind of probe. So the cubed, again, is one that I would really recommend folks check out. I, again, don't have any vested, monetarily. I don't gain profit from mentioning it, but it's one that I've used quite a bit and that is very helpful.
That's great. Thank you for sharing those. When a child does have a diagnosis of dyslexia, or I guess suspected, are you automatically screening for DLD too?
You should be. I don't think we are yet, but we should
Yeah.
be.
Okay. Yeah, and I'm thinking of like reading tutors that I've partnered with, and I don't know that there were DLD, so it would be
Exactly.
interesting to see. And who would you recommend in that case if it's just a reading tutor, like working with the child, they could be doing the screening?
They could, if they have understanding of how oral language works, they could. The cubed is very easy to administer and it kind of walks you through it. They might need some help in understanding, like interpreting what the scores mean, but it's easy to administer. I think again, going back to what we were discussing earlier, I think any educator that's working with a child should understand the DLD and the foundations of oral language because they'll probably understand that these kids are struggling. They just don't have a label for it. Like I see a lot of reading tutors that might be like, this kid just doesn't make progress. They're not understanding the concept. I think they have it. And then when I meet with them again, they don't. That could be DLD. Their oral language systems are not, let's say, functioning enough for them to hold on to information and learn from it. And so I would say that when you talk to reading tutors, they probably do have a good sense of the kids that are struggling with oral language.
Mm.
They just don't have a label for it yet.
Yeah, that makes sense. My wheels are turning for one of my clients that I have.
I love it. I
Um,
love that you're already starting to think about how this applies.
mhm. Do you have, in terms of inferencing, do you have any like practical inferencing resources that you like to use? Because in the past, the ones that I would use were so like scripted, but I don't know how practical they actually were.
Yeah, I think inferencing is one of those skills that you really initially have to break down for students. Like, first, you explain what it is. It's the combination of using background knowledge with clues in the environment and getting them to just, okay, so I need to do both things. I need to pull up what I already know, and I need to kind of look around and see if I can gather clues. And so I would start, if a student is struggling to make inferences, I would start with visuals, see if they can make an inference first using visuals. Maybe they just need to make inferences about their immediate environment first. Maybe that's the level that they're at. And then pulling it back further and further to make it more abstract. Then, okay, I'll read aloud something to you and let's make an inference. Then having them read it on their own, let's make an inference. So I would say that they have to understand, though, that making an inference means asking themselves, what do I already know? And what clues can I gather to help me figure out to make a smart guess? That's usually the word that I use with kids is
Hmm.
let's make a smart guess.
Hmm. Yeah, I've heard that before.
And that's important socially too. Sometimes I've worked with students on inferencing just in terms of social communication, right? And looking at what information can they gather from their peers to make an inference about how they're feeling or what they might do next. Sometimes using kind of just like authentic context, like social communication, social relationships could be helpful in teaching that skill too.
Hmm. Yeah, that makes sense. So you said that when you're doing your assessment, you're looking at like the sound, the word, the sentence, and the discourse levels. And looking at these evidence-based interventions, are these correlated with those levels? So, like, if they're showing difficulty with the word level, you want to build their vocabulary. If it's
Exactly.
sentence, you want to work on syntax. Okay. And then
Exactly.
discourse is more like narrative language and inferencing.
Exactly, exactly. So
Okay.
that's if you do good assessment, it will set you up. It will create a roadmap for intervention. I think that's a really
Mhm.
important part of assessment is that you're using it to design an effective intervention for a child.
Mhm. I like what you said. A good assessment will create a roadmap for intervention. It's tricky though, right? Like if you're just using the standardized assessment scores and you're like, let's say, writing goals based on that, then it gets complicated because you're just teaching to the test. But I see what you're saying, and like can help you develop like meaningful goals. Don't write the goals based off the test questions.
Exactly. The goals should be written off of the areas where they're struggling.
Mhm.
They shouldn't be the actual task that the
Mhm.
test is asking them to do. It goes back to kind of the TILs does really the way that those subtests are designed. They give me good information about where a kid is struggling so that I can design the goals. That's why I often use the TILs because it's easy to see where they need the intervention.
That makes sense. So, breaking this down even further, if they're having trouble with the word level, do you find that like once they've mastered that, then you have to go to the syntax and narrative language, or do those kind of fall into place? What do you find?
I would say work on those simultaneously
Oh,
and
okay.
teach, yeah, and that first, if so, at the word level, a common impairment that I see is kids have trouble categorizing vocabulary or making associations. They might struggle with that skill alongside of complex syntax, being able to form sentences using complex sentence structure. And so, what I would do is and then narratives, for instance, you have to use complex sentences to produce a narrative. And so I would work on all those skills simultaneously. I would find words that you want to teach that you can use in the context of sentences, and then build a narrative from a group of sentences. So ideally, teaching those kind of skills in an integrated way.
How do you differentiate DLD versus just broken up instruction or like gaps in instruction where these areas weren't explicitly taught?
That is a great question. I would say that for oral language, so again, DLD is an oral language disorder, and we don't have to be taught to make complex sentences in orally. We may need some explicit instruction when it comes to written language. In fact, many kids need explicit instruction to translate their oral language to written language, but speaking is natural, right? So if we're hardwired to speak. So if a kid has trouble producing sentences, then that's likely DLD and not an instructional gap. Where you might see instructional gaps is more in the context of reading and writing, perhaps,
Mm.
but not in oral language. Because again, we don't necessarily have to be taught how to, categorize words or tell stories. Those are abilities that typically developing children do on their own.
Yeah, it's fascinating. Like I could see how that's possible, like as long as everything's typically developing, but then if it's not, like, not grasping that your communication partners around you are modeling that language already for you.
Yeah, that's true. And sometimes, so that is an important point that you're bringing up. I think it is important to understand that DLD is not the result of kind of an impoverished language environment, right?
Okay.
Parents don't cause DLD, in other words. Again, it's going back to it's a neurobiological difference. It's hardwired. So kids are born with it. The environmental factors do play a role as well. So, for instance, let's say there are two children that have identical risk for DLD, genetic risk, that is. If one is born prematurely than the other, then the premature baby might go on to develop DLD and the other one may not. And that's because of that added environmental risk. So, environmental factors do play a role to a certain extent, but they don't cause DLD. It's something that's kind of already pre-programmed and will be triggered in an environmental context, if that makes sense.
It does. I think I'm getting really focused on, like, the interventions that are mentioned here, but if you go back to the symptoms, those aren't taught. Those just come naturally, like the ability to follow multi-step directions, needing, processing time, just telling a story, whether you're using the grammatical structures or not, and then having clear ideas, like those don't need to be explicitly taught. So, any thoughts on, like, targeted intervention for some of these areas too? Because again, I'm thinking back to, like, that auditory processing type therapy.
It's the same things that we've been talking about. Language is
Okay.
language, right? And when you work on categorizing words, you're going to improve that word retrieval, right? When things are
Okay.
more organized, you're going to be able to pull it out faster. So that will improve kind of using less use of vague words and more precise use of vocabulary. When you're working on syntax, that will help the struggling to follow multi-step directions, right? Because a lot of
Okay.
multi-step directions have before you wash your hands, go over to the sink and clean your food or something like that, right? So
Mhm.
a lot of heavy directions have that complex syntax in them. So, and then the last one, having difficulty telling a clear story. Well, that's narrative language, right? So those are kind of the discrete skills that will support these functional things.
Okay. Thank you for breaking that down. I just
Of
wanted to
course.
make sure that we made that very clear for anybody who
Of course.
is watching or listening. Do you want to talk a little briefly about these resources that you included?
Sure. So I these are just some free web-based resources where you can learn more about DLD. Also really helpful to point families and teachers to these resources. So DLD and Me is a website that's committed to fostering awareness of DLD, has lots of great information for educators, for parents to learn more about it. DLD, the second one, which is a guide for parents and families, is a really comprehensive free guide to DLD, and then Reading Rockets, which is a wealth of information about teaching reading, but they also have a section about DLD on their website. And then the last one is from the National Institute of Health, where they talk about the symptoms of DLD. It's a little bit more clinical. Again, just for SLPs to use to refer families to these websites as well. I often do at the end of evaluation reports.
Great. Thank you so much for sharing this. Do you want to talk a little bit about these articles as well?
Sure. So the first one by Adloff and Hogan, this is, I would say, a seminal article and really enhanced my understanding of DLD in the context of dyslexia. So it talks a little bit more about that simple view of reading, where we can clearly see the kids that have DLD, dyslexia, or both. Tiffany Hogan is out of MGH in Boston, which is relatively close to where I live. And she does phenomenal work in the area of DLD, and I've learned a lot from her from listening to her over the years. The second one is a difficult article to read just because of the how it sheds a light on how we're not currently best meeting the needs of kids with DLD, but it's an excellent article in terms of explaining really the real life impacts of DLD on children and why it's very urgent that we learn more about DLD and address it. The third article is a review of screeners that a team looked at in terms of identifying risk of DLD. And so it gives one of the resources in that article is a list of screeners that clinicians can check out and see what evidence they have behind them. And then the last article there is that Catalyst consortium that I mentioned. This was when a group of individuals met and decided this is how we're defining DLD. This is what it is, and this is what it isn't. It has a great Venn diagram that kind of shows the contrast between DLD and other communication disorders.
Amazing. Thank you so much for sharing those. I know I've heard of Tiffany Hogan's name quite a bit in this area, so I imagine those are good reads. And, we use this quality indicator. It's really for quantitative studies, but then you also have descriptive studies, which are what you've presented here. So it doesn't mean that the quality isn't good, it's just not a randomized control study. And I think that the fact that they're all open access means they're free to look at. I think that review of screeners could be extremely helpful. I will definitely be checking that out. And like you said, like how we fail children with developmental language disorder, that's so important. So I wouldn't discount these based on the color coding. I think they're still very valuable. They're just different types of studies. Kendall, thank you so much. This has been so informative. We just don't get enough information about dyslexia, first of all, and then DLD. You're probably our first person coming on talking about DLD. I want to say when we had our dyslexia conference that some of the speakers did touch on DLD, but it was more focused on dyslexia and reading and phonics instruction. So this has been really, really helpful today.
I'm so glad to hear it. I have a website that folks can check out if they want to learn more, and I'm always available by email. Happy to talk to folks and connect with folks across the country. I love hearing from people.
Amazing. Thank you again.
Okay, thanks so much. Take care.